Now, typically, it's men who lose more hair than women, right?
Not true.
No?
You know, I would say probably 20 to 25% of the patients that I treat are females, and it's absolutely devastating in females to have hair loss. And it's a bigger and bigger part of my practice. And for a female reaching her sort of 30s, 40s, or 50s with thinning hair, it's acceptable for a male to be bald, and a lot of guys really don't give two hoots. You know, I mean, a certain percentage of the population obviously are very concerned, but a certain percentage of males it doesn't bother. But if a female's losing her hair, 100% of them it bothers a lot, and there's very little most of them can do about it, except there's one medication, minoxidil, that'll help thicken it up a little bit, but hair transplant sometimes is the only option, and certainly some of my most thankful patients are females that come in.
But their hair loss is different as far as the pattern, right?
Yeah, it is a different pattern. I mean, males usually lose their hair according to what we call a Norwood scale, and what that is basically thinning in the front or on the crown area, and sort of general thinning, and then usually then complete hair loss, and you're left with sort of a horseshoe pattern. Females lose according to what's called a Ludwig scale, which usually is sort of generalized thinning with maintenance of the front hairline. So if you look at most females that thin, they maintain that front hairline, and they thin on top according to this Ludwig scale. And again, if you look at my website, it's got the Ludwig and the Norwood scale on it, and you can sort of see the direction that females head. But most females, I'd say at least 50%, maintain that density in the back. So most of them are candidates for hair transplants. There's a number of medical reasons as well that cause hair loss in females especially, and those certainly, before you consider surgical options, should be ruled out.
Now, so with the female hair loss, it's more intermittent, right? Because I really have never seen a woman who has like bald spots.
No, it's again usually just generalized thinning.
Yeah.
But it can become very thin. I mean, most of the women that I do, you certainly you have no trouble finding places to put the hair. It's very thin, and it's amazing the extent that some women will go to sort of cover up their thinning areas with combing over from the sides, or sometimes they'll get extensions and all sorts of things just to sort of cover it up.
Right. So it's a non-scarring technique, which is great.
Yeah. Well, the only scar that's left really is on the back of your head, because you do have to take a strip of hair out of the back, and the way you do it is take a strip, usually about a half an inch by 5, 6, or even up to 10 inches long, and then you suture the strip together.
Right.
And
never know, because
you
it's
wouldn't.
at the back.
I mean, if you looked at the back of my head, you'd have a difficult time finding the scar.
Right. Now, you get patients from all over the world, don't you?
Yeah, I mean, I see about half the patients that I see are from outside of Canada. Quite a few from the States and overseas, all over the place.
Now, how long have you been doing this?
Since 1995, 10 years, or 11 years now.
And what made you decide to get into the specialty?
Well, I did cosmetic laser surgery for about 8 years between 1990 and 1998. And started doing hair transplants in about 1995, and I discovered a new technique for doing hair transplants in the late 90s, and basically when that happened, my whole hair transplant practice kind of took off, because I was one of the first in the world to do this, a new technique that discovered, and so I was teaching physicians from around the world, and so I was getting people flying in for this new technique that I was doing, and so it just took off, and so I gave up the rest of my practice.
Oh, good for you. And where are you located?
In Oakville, right just north of the hospital in Oakville.
And how can people contact you?
Well, through my, I guess through my website, which is just torontohairdoctor.com, or at telephone is 1-877-789-4247.
Great, Dr. Jones. Thank you. Very valuable information.
Great. Well, thanks to be of help.
Yeah, great. You're watching The Source on pt.2.